This is video 3, so we'll continue with the blood test. We are dealing with the diagnosis of the malabsorption syndrome. So here in blood test again, when we test all the vitamins level, okay, and all the electrolytes level, we would be, and nutrients level, normal value, we can check and we can identify whichever is less. There is a possibility of deficiency of that particular nutrient in the body, which is caused because of the malabsorption syndrome. So the various tests which can include, okay, so these tests measure the level of specific nutrients in your body, such as vitamin B12, vitamin D, folate, iron, calcium, carotene, phosphorus, albumin and protein. All this can be checked and the normal value of the blood levels can be assessed. Then a lack of any one of these nutrients may not necessarily mean you have malabsorption syndrome, but further tests can be given, or we can also assess whether the child is trying to avoid a particular kind of food where these vitamins are found. It can mean you are not choosing food with healthy levels of nutrients. Normal levels of these nutrients suggest that malabsorption is not the problem. If there is normal levels when you do the blood test, then we get to understand that there is no malabsorption syndrome. Okay, now breath test. What is this breath test? They will take the breath and they will be assessing for hydrogen if it is present in the breath. Now why do we do that in that condition? Okay, so breath test, it is mainly used to test for the lactose intolerance, okay, where the child is not able to digest the lactose. So if lactose is not being absorbed, it enters the colon automatically, right? So it enters into the colon, that is from the small intestine, it enters into the colon. And then bacteria, we know that there are normal flora, which is very important. So these bacteria which are the normal flora in the colon, what they actually do is they break down the lactose and they convert that into, or they produce that into hydrogen gas. So now there is excess of hydrogen which is found right in the intestine itself, in the colon, which is absorbed by the intestine into the bloodstream. So from the colon it is entering into the bloodstream, and automatically, because it is a gas, it enters into the lungs. So when the child or an individual exhale, okay, so during the respiration, this hydrogen, because it is excess in the body, it will be exhaled outside. So when they do the breath test, they will take the breath and they will assess if there is hydrogen gas that is found. If it is found, then they will get to know that there is an lactose intolerance. So that is about the breath test. So far we have seen stool test, that is mainly for the fat, then blood test for various vitamins and nutrients, and then breath test to find out if the child has got lactose intolerance. Okay, next you have imaging test. As usual, CT, MRI can be taken to find out the structure of the intestine, if there is any thickening, which can be because of Crohn's disease. Again, we have seen that Crohn's disease is also one of the cause which can lead to malabsorption disorder. Okay, then biopsy. So biopsy, you know that, right? So they either through endoscopy they can do, and then they can take the biopsy. Okay, so certain part of the cells of the intestine will be taken, okay, or the sample will be taken. So it can be taken. So when we say that the test will likely be doing with an endoscopy, so here, as you know, and you have witnessed also, right, in the hospital Kidwai. So here a tube will be inserted through the mouth and it will be sent through the esophagus and the stomach to the small intestine, and there they can take samples of cells to find out what exactly is the problem with the intestine. And then, so these are all the various tests that could be done, diagnostic tests. So starting from history collection, physical examination, the other tests what we have seen, okay, that is the stool test, then blood test, then breath test, imaging test and biopsy. So next we will get into treatment. So what exactly, how the baby can be treated. So treatment options for malabsorption syndrome, it actually addresses the symptoms such as diarrhea. So when you see, usually as we have already dealt, that the individual will be having marked diarrhea, right? So medications such as lochromide, it can be given to replace the nutrients and fluids that the body can be able to absorb. So lochromide to stop the diarrhea, so through which the absorption also can be enhanced into the body, and they also will be helping to monitor and whether it is being functioning. So it is just a symptomatic treatment, but the underlying cause has to be treated, and we'll have to check if the child enters into dehydration, anterior fontanelle, sunken eyeballs, and then dry lips, dry tongue, all these, okay, so all these are signs where you can actually look out if the child is going into signs of dehydration. So again, the baby will have increased thirst, will be there, low urine output, okay, so dry mouth, skin or tongue. So these are the other things which we have to keep in mind in order to assess if the baby is ending up with dehydration or not. Very important. And then next you have, because it can also lead to low BP, and again it can lead to anaphylactic shock, so we have to be very careful. So next, your doctor will provide care based on the cause of the absorption problem. So whatever symptomatic treatment, underlying cause has to be find out. If it is because of lactose intolerance, then we have to avoid milk or other dairy products, okay, without, if the mother is not put on lactase enzyme tablet, then she has to avoid. Or if the mother has been provided with lactase enzyme tablet, if she is breastfeeding, then she can breastfeed, okay. Or if the child is older enough to take by himself or herself, then we can give this lactase enzyme tablet, which will avoid this lactose intolerance or effects in the individual or in the child. Then you have, at this point, doctor also should consult with the dietitian. So according to the food requirements and nutrients, the food has to be decided. So next we will see there are two types of supplementation that has to be given. One is enzyme supplementation and vitamin supplementation. So when we say enzymes, these supplements can help the body to absorb the nutrients. Okay, as already we have seen, like how lactase enzyme tablet can be given. Okay, so this helps in the absorption. And vitamin supplements, we know when the body is unable to absorb certain vitamins, so certain supplementation can be given to the individual or to the child. So based on the dietitian, okay, or the experts consult, these nutrients whichever could be absorbed should be given to the individual. Then diet changes, talking about the diet changes. So the dietitian will be helping in this, where they could able to adjust with the increase or decrease certain foods or nutrients. So which food can be added, which food can be avoided, okay, that also is very important. For example, to avoid foods high in fat to decrease diarrhea when the child or the individual is already having struggles, okay, or the problem of absorption of fat, so that can be avoided because it decreases the diarrhea. And we can increase the food high in potassium and help in the balance of the electrolytes. So monitoring the electrolytes and planning according to it, so the child does not lose any of the required nutrients or the electrolytes. So this is based upon the dietitian's counseling. The food has to be given and necessary dietary changes has to be done. So these are the various treatment modalities and modification that has to be done. Okay, so it includes enzyme supplements, vitamin supplements and diet changes. So next we will go into celiac disease. So next condition we will continue with celiac disease, which is also known as gluten induced enteropathy, gluten sensitive enteropathy. So here the child is unable to digest this gluten, and in severe condition the child will also have allergic reactions. So we have to be very careful. Now what is this gluten? Gluten is nothing but it is the protein, okay, it is a group of protein, okay, so glutenins, it is called as glutenins or prolanins, okay, so these are certain kinds of protein which is found in the food which is not being able to digest by the child, okay, so that is called as celiac disease, or it is also called as glucose induced enteropathy or gluten sensitive enteropathy. Okay, it is gluten induced enteropathy or gluten sensitive enteropathy. So when we say the celiac sprue is a disease of the proximal small intestine characterized by abnormal mucosa and permanent intolerance to gluten. So you know what is proximal and distal. Distal is far end. So proximal is very close end to the intestine, that is a small intestine. Again we will see that it has an abnormal mucosa, and then which can lead to permanent intolerance to gluten. So the age that this condition first appears and prevalence have changed over the past 30 to 40 years. It's seen more frequently in Europe. The incidence, when you say, it's more in Europe than in America, and is rarely reported in Asians or blacks. So even in India it is rarely reported, but we get to see a lot of cases in the Europe. Okay, so now Pathophysiology is not required for you, but since it is given, I'll just explain on it. So this disease is characterized, and you can also see the normal cells and the abnormal mucosa that is given in your diagram. So this disease is characterized by intolerance to the gluten protein that we know. So where all do we find this gluten? It can be found, in the wheat, barley, rye and oats. Even in oats you have, okay. So these are the food where this gluten, it is a group of protein which is not tolerated by the intestine, okay. So it is protein gluten which is found in the wheat, barley, rye and oats. So generally when we see these foods are actually healthy foods, but because of the presence of gluten, they can consume if there is gluten-free wheat flour or barley, rye and oats. If it is gluten-free, then it can be given. But in case of if the person is affected with celiac disease, it is better to avoid if the gluten is not removed. Although the pathological process is still susceptible, individuals are unable to digest the gliadin component of gluten. So it is a component, gliadin is a component of gluten which has not been digested. So we get to know now where it is found and what is gluten. Okay, so next we will move on to diagnostic evaluation. So when we see this diagnostic evaluation, as usual, history collection, physical examination has to be done, and symptoms of CD, that is the celiac disease, should be usually it is noted several months after the introduction. So once when we start giving all these gluten containing foods to the child, okay, between the age of 1 and 5 years, and we get to know that if it is not tolerated by the child, so biopsy also can be done of the small intestine, and then it can be detected, okay, if the intestine is not functioning properly, okay, or any abnormality, okay, of the mucosa. When you get to see, you will get to know that the child can develop gluten free. It is one of the cause. Okay, then auto antibodies of IgA, anti-reticulin and anti-endomysial IgA are more specific markers for active celiac disease than circulating IgA anti-gliadin antibodies, which may be present in other diseases. So basically when we do the blood test, we will be able to find more of these antibodies, that is IgA, anti-reticulin and anti-endomysial IgA. This will be more when compared to the circulating IgA anti-gliadin. So the two increased antibodies, that is the IgA, anti-reticulin and anti-endomysial IgA, this will be increased when we do the blood test, and we get to know when these two antibodies are increased, then we get to know that the baby has got celiac disease or an individual is suffering with celiac disease. So what are the various therapeutic management here? So treatment of chronic is primarily dietary, so dealing with the food, avoid all the gluten content food. Then children with untreated celiac disease, they can also develop having lactose intolerance. Okay, so where we see that thickened intestinal mucosa will be there, or intestinal mucosal lesions will be there, which usually improve with gluten withdrawal and intestinal healing. So automatically when we stop giving all this gluten content food, the intestine will be healed, okay, so or it should be withdrawn. So that is very important. Then specific nutrition deficiency are treated with appropriate supplements. So certain vitamin, iron, calorie supplement can be given, or gluten free food can be given if it is available. So prognosis, when you see, it is actually a chronic disease and it varies among children. So the most severe symptoms actually happens among early childhood and again in adult life. So basically they should avoid all these kind of gluten content food. So coming on to nursing management. So main nursing consideration is helping the child adhere to dietary management. So teaching them, so this what foods has to be avoided to the older children, or it should be taught to the parents. The specific role of gluten is aggravating the condition, so that food has to be restricted. Although the chief sources of gluten is cereals and baked foods, grains are frequently added to processed foods as thickness or fillers. The nurse must advise parent to read carefully all ingredients on labels. So whenever they purchase any kind of bread, certain bread also has got gluten. So baking products, they should make sure that mothers, parents are careful in reading the labels and then buy the food for the children. General management includes, so diet can be increased in calories, proteins, with simple carbohydrates, where the child can be given with fruits, vegetables, but they should again be low in fats. Then several organizations and resources are available to help families cope with this condition. So where broadened health education can be given to the parents. So this is about the nursing management. Okay, so we have seen celiac disease, the definition, the incidence, the pathophysiology, then diagnostic evaluation, therapeutic management, prognosis, and the nursing management. So next video we will see with the next condition.